Bye guys. So what I want to do is we're going to do Ask Dr. Collins live in probably like a half an hour. But I want to ask you guys for health-related questions, so I have some to include in the video that we're going to make. So you'll be featured. I'll tag you guys if you have a question in the video. Welcome to the Ask Dr. Collins show. I'm going to be answering questions that came in from Instagram Live earlier while we were at Blue Door. I want this to be a show that we did it about 6 months ago and we've taken a break, but I want to get back in the rhythm of giving people the opportunity to talk to a doctor on Instagram Live. Maybe we'll be doing it on Facebook Live in the future, but ask real-time questions about wellness care, the spine, what I do in here, and get those kinds of answers that they're looking for outside of Google. Actually be able to talk to a provider. Things are really busy now. When you go to the doctor, you have like 5 minutes. So that's what I want this to be. I'd like to cycle through and answer some of those for you guys. And if there's questions that are coming through right now on Instagram Live that are good, we'll throw those in there as well. I will tag you guys in the videos that come out, so you'll get a little shout out as well. So with cervical spondylosis, it can be asymptomatic, but often people can report sometimes pain, muscle pain, pain in the spine, but a lot of times you can have people who are walking around with a pretty nasty spondylosis that have no clue. You should, if you have an upper cervical doctor that is somewhere near you, you should go to them because they're going to help open up your posture overall, which can help take pressure off of the muscles. A lot of times, even with upper cervical work, you can still see that scoliosis in there, but you won't have the same pain and misery as a result. It can. In our office, so what he's asking is, can getting the atlas adjusted, doing this kind of work that we're doing, help bring a curve back in the neck? And a lot of times it can. For people who have had a whiplash trauma, they're going to lose that normal curvature. Basically, you have ligament, like a webbing of ligament around the column. If you've ever been hunting before, or you've seen like a cadaver or something like this, the spine is actually wrapped with ligament. It's not just bones there. That's what gives your spine a lot of its integrity structurally. When you have a whiplash trauma, it'll actually tear and soften, weaken, give more play in those ligaments. Your body will actually tighten up deep muscles around the spine to create an artificial stability. So that loss of curve equals whiplash trauma, damage to the ligaments. So in this office, along with realigning and maintaining that alignment with the atlas, I'm putting people on a cervical or a Denny roll is what it's called, which is a block to help retrain it. Okay, one is how are you lifting? And this is, everybody kind of knows this, but instead of hinging, a lot of times you're gonna notice yourself just due to weakness in your legs, you're gonna wanna hinge at your waist. Don't do that. Get in the habit of using your legs, your quads, your squat strength to come down and pick a baby up, and making sure that your transverse abdominis or your core is engaged when you do that. When you hinge at the waist, you're basically shutting off your core and putting all the demand on your back. So one, like I've said a million times already, get your neck checked, make sure your atlas is in alignment. When my neck is out, my back will get tight. I lifted how many bags of mulch the other day? I was picking up bags of mulch and everything. Well, my neck was out and my back got so bad I was in spasm, and it took me a week to feel better once I got adjusted. So get your neck checked, but two, make sure you're lifting properly, like I said, with your legs. If your legs are weak, you're gonna notice you're gonna compensate by hinging and using your low back muscles to help generate that, and don't do that. In terms of what do you do now beyond that, heat can help at the end of the day. Stretching, not passive stretching, but more active stretching. So instead of bringing your knees up and pulling them, where you're going to shut off your core to do that stretch, you want to allow your knees to come up and your body to hold that without bringing your hands in there. So you want to create a stretch naturally that's not passive, and that will help open up your back without creating any inhibition. So I'd have to look that up, but not like specifically on overall holistic nervous system care, right? But if you can imagine having tension on your upper cervical spine, all of the nerves that are running out, your brain is a bunch of wiring, all of that has to pass out through the base of the skull and into that ring of your atlas. So if I have that displaced and I'm putting tension through that area, if I'm compressing blood flow into the skull and out of it potentially, if there's congestion there, long term, with that being out of alignment, you're looking at potentially decreased blood flow to your brain, inflammation, as things like MS, Parkinson's, Alzheimer's, like neurodegenerative, like nerve degeneration stuff going on. Overall, having tension on your nervous system. So in here, people will report when they get that released and things open up that they'll have less fatigue and anxiety and sort of more peace, like relaxation and energy. If you can imagine somebody sitting there like pinching your brainstem. So in terms of like specific symptoms, there's different studies, like high blood pressure is a good one. So the University of Chicago, with a guy named Marshall Dickholz, who's a chiropractor, he did research on adjusting the atlas vertebra and seeing marked decreases in blood pressure as a result. So the equivalent of 2 meds, blood pressure meds, which was sustained blood pressure over months. So that's one. There's interesting studies on MS. I'm trying to think. Lots of stuff on like migraines, neck pain, things like that. But it's good. Get your neck checked. Don't be out of alignment. Dr. We gotta go.